In hematology, we have the great fortune of having a lot of wonderful investigators and clinicians, and we know that about half of them are women. Unfortunately, when we look at strong leadership positions when it comes to clinical trial leadership or perhaps notoriety on a podium, we don't see the same 50% representation. We know that women don't necessarily tend to have 50% representation in key leadership positions, for example, in clinical trials or key speaker positions, and this might be because there might be a trend towards perhaps having people that are already established in their careers or maybe very well known and maybe known by other people that also have decision-making power. And we're really trying to change that by having as many people as possible have the opportunity to be able to be in these key positions. In addition, we're trying as much as possible to create opportunities, however that may be, by increasing interaction between women hematologists and or supporting other ways that women hematologists can interact, as well as learn from each other and have opportunities to meet each other. And we think this is a really important way for us to promote women in hematology. I think one of the biggest barriers in trying to implement something like this is its change, and change is always difficult. You have to be actively thinking about this. When I think of people or places, I should say, when I think of societies that have been really successful at this, I think of ASH and ASCO and EHA really making a conscious effort to have 50-50 representation in their speaker positions, and I think that's something that we can learn from as well. So I hope that we can all work harder against these challenges of inertia so that we can make this happen. The biggest piece of advice I'd say to women on oncology is that oncology is a fantastic field, and I actually think it's a fantastic field for women. So keep at it. I think this is a place where women shine because it combines everything: academics, it combines clinical care for patients, and science. And these are things that we all excel in, and I'm really, really excited to be a part of this as a woman in oncology.